3, 2.
You need to be aware if of your client possibly having any arthritis. If the bone looks swollen and contorted, then this is contraindicated because it's going to hurt if you try to bend that toe. So coming here, we're going to do a little decompression, pull them out. Good. Now this is my go-to move with the feet. If you're ever stuck or thinking about what you're going to do next, or you just did something intense and you want to do some make nice for a minute and let the nervous system calm down, you can do this all day. And its other benefit is, of course, that you're mobilizing these joints. So this is getting the top of the foot. Now we're going to come into the heel. I'm going to get the heels to move through their full range of motion. We're going to come to the top of the foot. We're going to do a little myofascial release through the top of the foot. You've got a couple of joints right up here that are often jammed. So this is a nice technique. Again, it can be a little bit burny. You have to check in with your client to make sure that it's not too much. Taking that joint right there and opening it up. Oh, just had a little foot adjustment. We aren't specifically trying to manipulate the joints. That's not within our scope of practice. But as you're taking these joints and taking them through their full range of motion, don't be surprised if you get a little popping and crunching from time to time. So opening up this joint now, stretch and open. And the top of the foot. Good. So from there, I'm just going to decompress a little bit. Sometimes that joint gets jammed because we're standing on it all the time, and there should be a little space. So it's good to just nice little small amount of tractioning that joint open, and the first one that we were doing. Good. Now, so we've looked at these set of joints and these set of joints. Now we want to move down from here to here. So I'm just going to take this joint and I'm going to see if that joint moves. And I have nice play with that. And that one's moving. That one not so much. So I'm going to get into the bottom of the foot and kind of dig out those muscles that are surrounding that joint. Coming up to the top of the foot and doing a little myofascial release there. Good. A little more on the bottom here. Good, so now I'm taking this joint, I'm following it to the next joint, and just, it's kind of a wave, and you should be able to feel the joint move underneath your fingertips. And this one is a little stuck. Is that tender there at all?
No, it definitely feels a little stuck, but it doesn't hurt.
Okay. So what I'm feeling is that this is just slightly not in the right position. So I'm going to do that same technique of kind of opening that joint, but I'm going to add a little bit of rotation. As I'm looking down at her feet, this toe is slightly rotating this way. So I'm going to take that whole bone in the toe and I'm going to rotate it back, and now I'm going to do that same technique in position and direction that it wants to go. There we go. All right, so That's starting to get going. Going back to my standby move. Other thing that we can do with a foot is, so we were just focusing on each joint, but we can also move and separate those tarsals. So grabbing on one tarsal on this side, one tarsal on this side, and going side to side and back and forth. Just getting some mobility, trying to feel for any joints that are dysfunctional, not moving. Good. And of course you can do, pressure point therapy, and all of this is nice. You can get a little oil and massage this down. But if you're really looking to make any structural changes within the foot, I really suggest targeting the joints and knowing which joints are doing what. Perhaps in a future video, we'll actually do some foot exercises that you can do on your own to make sure that these joints stay open. Actually, that one's a little stuck too. I was just about to go onto the other foot when I realized that needs to open up. Good. There we go. Starting to get that little wave of that joint opening and closing. All right, let's go on to the next one. So, again, my standby move. Never heard a complaint about this technique. Oftentimes it's people's favorite. You can do this up high. You can do this a little lower. Up at the balls of the feet is probably the best result though. All right, so from there, we're going to open up the ankles, full range of motion. You can also, as you're doing that, target other joints by taking the ankle into that open position and then twisting the top of the foot on the fixed ankle. And I'm going to close that joint all the way, and I'm going to do the same thing. Good. Stretching out this foot, getting these joints right beneath the ankle that can get stuck. Flat hand, a little myofascial release as that joint gets tractioned open. Remember to check in. Just if your person on your table has really tight fascia in this area, it's going to burn and they might jump off the table. So move slowly and make sure you're communicating with your client. Good. A light traction. From there, moving up into the toes, and I'm just getting a sense, okay, that joint moves, that joint moves well, that joint moves well. That joint is stuck, seriously stuck. So the way I can tell that is I'm feeling, as this is bending, I can feel this part of the joint pop up into my finger, and this one does it, but when I do it with this one, it's stuck, it's not bending. So we're gonna get into a little work here to try to change that. See if we can't get a little more motion through there. coming up right next to that tarsal. Coming up, releasing that. Both sides. You can also activate the muscle in order to get a better release. So Karina, what I'd like you to do is to curl your toes around my finger. So you're going to make a fist with your toes. Good. And relax. And that activation will help to get the muscle spindles going, get information into your brain. And top of the foot, same thing. So this is the joint that's not opening. We're going to come right next to it and we're going to scoop all of this out. That's starting to move a little better. And she's going to need to do some regular toe exercises to really mobilize this. And big toes all clear. So we're going to move down to the next set. Getting those tarsals separated. Good. And coming down to this level. And up into here. All right, well, thanks for checking in again. And please make sure to like and subscribe, and also check out our new site, bodyworkmasters.com. I'm going to have these videos and also content from other instructors that I find helpful and informative. See you next time.